Hello student, now we see the Norma Verticalis. So Norma Verticalis means when we see a skull from the superior view, and if you see here the outline of this skull from the superior view, it is a little bit like a oval in the shape. The posterior part, this posterior part is a more broad as compared to the anterior part, right? Now, so it is a shape is a oval shape. Which bone take part in this formation of the Norma Verticalis? The one is, this is a upper part of the frontal bone, both side of the parietal bone, and little bit from this side also, that is a upper part of the occipital bone. It is also we take in the consideration upper part of this occipital bone, right? So which are the bone forming the Norma Verticalis is, if we start from here anteriorly, you can also identify the anterior and the posterior end. How you can identify? So one, by the broadness. Posteriorly it is a broad, anteriorly it is a little bit a narrow as compared to the posterior end, and here also you can see this is the nose area, so this is obviously the anterior end. Now, so which bone forming? Frontal bone, anteriorly upper part of the frontal bone, which is a single, then both side of the parietal bone, and this is occipital bone, upper part of the occipital bone, which form the Norma Verticalis. Now which are the suture we will see in the Norma Verticalis? One, this suture we can see, this is the orientation, is a coronal in the plane, right? This suture it is a coronal in the plane. This is known as a coronal suture. This coronal suture is separate this frontal bone from the parietal bone, right? This is the frontal bone, this is the parietal bone. Between these two, this suture is a coronal suture, right? So it is on a complete from side to side. Another suture is, this is in the sagittal plane. So this is a sagittal suture. It is separate the both side of the parietal bone. So on each side there is a parietal bone, in between that is joined by this sagittal suture. Okay, then another suture we can see on posterior side. Okay, here, yes, this suture which is going downward and laterally, okay, which is between this is the two parietal bone and this is occipital bone. So between the parietal and the occipital bone, this is a lambdoid suture. So basically we have the three suture, okay, which three suture? Between the frontal and parietal, this is a coronal suture. Between a two parietal, sagittal suture, and between parietal and occipital, this is a lambdoid suture. Okay, so this is the three suture which can see in the all the skull in a Norma Verticalis. Now sometime what happen, between a two frontal bone also we can see a suture, that is known as a matopic suture. It is not always present, and if present also, it all majority cases it is closed by the 6 year of the age. Okay, it is a matopic suture between the two frontal bone. So three suture mainly, it is a coronal, sagittal, and this is lambdoid suture. Okay, so this is the bone and the suture we have seen. Now which are the other important aspect in the Norma Verticalis? Now one thing you can see here very prominently, these foramens, right, which is on the, okay, this foramen on the each side of the sagittal suture in the parietal bone. This is known as the parietal foramina. Okay, right? So it is on the each side of, yes, it is this and this, which is on the each side of the sagittal suture on the parietal bone. So it is known as a parietal foramina. We will see the many foramina on the skull, and the main structure is passing through the foramina. It is the imaginary vein, and this imaginary vein it connect the scalp vein with the intracranial venous sinuses, and the main function of this connection is to maintain the intracranial pressure. Okay, so from here again the imaginary vein is passed. It is a parietal foramina which is about 2.5 to 4 centimeter in front of this junction between the sagittal and the lambdoid. Okay, we have left the junction just now. First we see the name of the junction. Let's see. Okay, this is the coronal suture, right? And this is the sagittal. At their connection, meeting point between the coronal and the sagittal suture, it is known as a bregma. Meeting point between coronal and the sagittal suture, it is known as a bregma. Now here, this is meeting point between sagittal and lambdoid suture, it is known as a lambda, right? Meeting point between a sagittal and the lambdoid suture, it is known as, this is known as lambda. So this parietal foramina is about 2.5 to 4 centimeter in front of the lambda. Now the point on sagittal suture, point between a two parietal foramina on a sagittal suture, it is known as a obelion, right? Point between two parietal foramina on sagittal suture, it is known as obelion. Okay, another, like, now this is the area which is of the maximum convexity in a parietal bone. It is known as a parietal eminence. It is known as parietal eminence. Now here, when we see the skull, this is the convexity of the upper part, that is a vault of the skull. So the highest point on the sagittal suture, it is known as a vertex. Highest point on a sagittal suture, it is known as vertex. In this part, it is known as a vault. This is known as a vault of the skull. Or you can see a skull cap. We can remove it, and we will see in later on in the cranial cavity. Okay, so this is about the Norma Verticalis. When the skull, we can see a skull from exactly above.